The elderly population is growing fast. It is estimated that by 2050, 20% of the US population will be elderly. This means 1 in 5 citizens will be 65 or older. One of the difficulties that this age shift presents is that a huge number of people will begin to require care that they do not know how to obtain. It's a fact of life that as people age, they can do less for themselves and require support from others. But what happens when 1/5 of the US population is struggling to meet its care needs? Early action is vital to navigate the long-term care system and avoid the possibly dangerous results of insufficient preparation. The purpose of this presentation is to demonstrate why elder care planning is essential to aging with peace of mind and to help people plan successfully for aging. The elder care system is complex and can seem daunting to those who are new to it, and when a crisis arises, families often don't know where to turn. Planning in advance for elder care is extremely important. It allows aging citizens to shape their future and retain control over the later portions of their lives should crises occur. One issue that preparation combats is the tendency for elderly citizens to be unnecessarily admitted to nursing home care for prolonged periods of time after hospitalization. However, if a patient possesses knowledge of a preferred alternative such as home care services, premature nursing home admissions can be prevented.
One of the unfortunate things we run into, I've been doing this for almost 25 years now, one of the things that I've noticed that we run into is a lot of times people don't think about these type of services until there's actually a crisis. Mom, dad go in the hospital, they've had an acute episode, perhaps they've had a heart attack or a stroke, unfortunately, and they're coming home. The children are home for that, but they live out of state or they have jobs, they have things they have to do, they can't be there, they don't know what to do. And no one's ever thought about it. Always one of the takeaways we always get from family members and from clients themselves, when people are sick, when they don't feel well in general, whether it's an acute condition, or it's a chronic condition, they want to be in their home. People want to be at home and they want to be cared for in that place. It's where they feel comfortable. It's a familiar surrounding. They're not in a strange environment. They're not around strangers. It's a stress level. It adds to their stress level and they don't feel as comforted.
Now we know the significance of home living. Living in an alien environment and losing independence has been known to cause depression in seniors, and depression can lead to the deterioration of a senior's physical state. Improper planning can result in poor care placement such as this, and, even more dangerously, result in a lack of care.
The other issue is health impact. If you think about a hospital stay, hospitals are designed either through surgery or some kind of intervention to basically repair something that's broken. But once you're done with that hospital stay, ongoing care is key to recovery. So if you need that high level of care and do not get it because you haven't prepared for it, you could definitely have a relapse in your health condition and end up back in the hospital, or in worst case, could lead to death by not getting good continuous care through a long-term care service. So what we see, especially in the home health area, a lot of time is what we call the hospital readmit problem. So someone's been in the hospital, been there 2 or 3 weeks, what have you, gotten better, discharged home, but within a month has had to be readmitted for an exacerbation of the same problem.
As with repeated hospital visits, long-term care can be very expensive. The average part-time home healthcare aide costs $24,000 a year. The average assisted living facility costs $48,000 a year. And the average private nursing home costs $87,000 a year. Without proper financial planning, elderly citizens and their families can be put under a tremendous financial strain. Additionally, non-elderly people are commonly pulled away from the workforce to care for an elderly family member. Without an income, the family caregiver will be unable to save for his or her own future care. One of the biggest potential ways people can pay for long-term care is through long-term care insurance. But in 2012, less than 3% of the elderly population had purchased it. This low percentage of insured seniors is mostly caused by low awareness of long-term care insurance, and by the misconceptions people have about how much of their expenses Medicare will cover.
Many times people have a predisposition of thinking that Medicare will pay for any senior care they might need, such as an in-home aide or someone to come in and help clean their house. Medicare does not pay for everything. Medicare only pays for certain types of long-term care. For example, if you've been in the hospital and need rehabilitation therapy in a nursing facility, Medicare will pay in full for 20 days. But it does not cover long-term care, and it does not cover in-home care as a general rule on an ongoing basis.
There's not a single payer for health care in this country. You know, it can be Medicare, it can be Medicaid, it can be Veterans Administration, it can be community block grant, private pay or a private insurance policy, or a myriad of other payers. They all have different requirements. They all have different things they'll cover or they won't cover. And so that really makes it so important that people take the time ahead of time before there's a need to understand what are they likely to be covered for? What is their insurance policy cover that they currently have? Maybe they have an insurance policy through their employer right now. Does it cover this type of service? You should take a look at it. They should take a look at it.
Knowing about the financial and health risks of insufficient elder care planning can help people grasp the importance of early preparation and get started. In the upcoming section, I will address the best ways to plan for long-term care and the people to involve in the preparation. Elder care awareness and preparation is important for people of all ages, but it is vital for people around the age of 65 to start taking action. The first step of planning for care should be to meet with close family, friends, and neighbors to discuss current and future needs. These needs can be as simple as help with cooking, transportation, and household chores. It is in this way that people can determine who in their social circles can be counted on for support. Work schedules, family life, and driving distance are important to consider when deciding which family and friends to rely on. To ensure that no one person is pressured with a large work commitment, it is advisable to find multiple people willing to help with various tasks. Once family caregivers have been selected, it is important that they stay involved with future elder care meetings and choices.
Seniors typically want their family involved because they always need another set of ears and another set of eyes when they're doing long-term care planning. So I do encourage families to stay very involved with their aging family members or friends, because many times you will see things that maybe the older individual hasn't identified as a need and can help suggest other options and other methodologies of meeting the needs they may have. So families are very key. Families being connected help the older individual feel like that they're not alone and that there's someone that they can also call within their family that they trust and who can help them make those choices, because usually family members want some help making those choices as time goes forward.
Certainly family dynamics have changed over the years. You know, the nuclear family is no longer something you have from like the 1950s where everybody lives in the same community or even in the same house. Kids nowadays move away. You know, family, their parents may be living on their own, or one parent may be deceased and the mom or dad is living on their own, and the children may be half the country away. And so we do a lot of also trying to work with them by phone or use other type of media, whether it's internet, to communicate with them by email, things like that. So they're involved in the planning, but we do try to identify a caregiver that can be there when we're not there to also help physically with the client.
After consulting with loved ones, elders would be well served to seek guidance from professional senior care workers to find the best suited elder care programs. A good patient-doctor relationship is particularly useful at this time because doctors accompany elderly citizens through the many stages of their lives and are a major source of elder care information and referrals for care. As part of planning for aging, a retirement age adult may consider transitioning into the primary care of a geriatrician. Geriatricians are the ideal doctors for most elderly citizens because they specialize in senior health and the complex set of diseases that can accompany aging. However, there is currently a nationwide shortage of geriatricians and a rising demand, so aging adults who want optimal care should secure a geriatrician as soon as possible. Besides doctors, a major source of elder care information and support is the Area Agency on Aging, or AAA. But what is the AAA, and how does it help aging citizens?
We are a federally mandated agency. In fact, there are about 629 of us throughout the country who are working with local partners, local counties, and leadership to plan programs for older adults and administer the monies from the federal level for those programs. Many citizens do call us for information on what resources are available in the community. And typically what I like to do, if they can come to the office or if I can go to them, I like to sit down and talk with them about what their needs are. And when I can determine what needs, or one of my staff can determine what needs is there that they currently have identified, then we can better craft services and resources in the community for them. So it definitely takes sitting down with people either by phone. Some people do it by email, actually, particularly if it's someone who's not living in this state right now in this community. But we like to sit down, talk with them, let them know what the resources are, know what their issues are, and what they want. We also like to ask people, what do you see in your future? How would you like for your future to look? And in order to do that, we have to do some what we call future planning and give them options so that whole options counseling piece is there before people ever need it. So they have crafted a plan that is distinctly their plan, not my plan, not anyone else's plan, but a person-centered plan that meets their needs and their desires as their life moves forward.
While planning for their care, it is imperative that aging adults consider the financial aspects and establish the means to pay for care, advisably with the assistance of a professional in finance. The AAA can assist by referring a financial advisor or elder care attorney in this case. There are 4 long-term care coverage methods to consider: self-insurance, Medicaid, life insurance or annuities, and long-term care insurance. Self-insurance is another term for paying out of pocket. Medicaid is only qualified for by those whose income and assets fall below a certain level, which varies from state to state. A life insurance policy is a very useful investment tool that earns the owner a fairly low rate of interest, but builds up money over time that can be used to pay for long-term care needs. Finally, long-term care insurance can cover most or all of any needed long-term care service, especially when timed and used judiciously. Both life insurance and long-term care insurance benefit the user most when bought well in advance of needing care, because premiums stay low and the cash reserves have more time to build up. After looking into personal finances and insurance plans, it is also important to assess costs and possible financial assistance options for the different types of elder care.
Typically, when someone has more assets and they won't qualify for Medicaid, they can come to Elder House through a couple of ways. One is they could pay cash on a monthly basis, and the Medicaid portion is what they're responsible for. Medicare pays a portion for them if they have Medicare, and that cash outlay is about $3,300 a month for those services. The other avenue is through long-term care insurance. A lot of that insurance is designed for nursing facilities, and nursing facilities cost about $4,500 a month. So when long-term care insurance learn about PACE, and our fee's $3,300 a month, a lot of times they're very willing to negotiate a PACE rate and work directly with us to pay the portion for private pay individuals. So they get the same services, the same all-inclusive rate covers everything the individual needs as Medicare and Medicaid participants. So we can't discriminate based on payer source. Everyone gets the same all-inclusive care.
The requirements for our program for senior adults, and it's by federal law, is that you must be 60 years of age and in need of the service. We do not base the program, and the federal government does not base the program on your income. It is based on need and your age. Therefore, our program is more of a grant program. It's not an entitlement program, and we're able to serve those folks who have a need as long as the money is there and they meet the qualifications of the specific program that they're asking for. Example, for a home-delivered meal or an in-home aid. There's certain standards that have to be met and certain qualifiers. But as far as income, there is no income level. It's 60 years of age and in need of the service.
Planning with family, elder care professionals, and financial advisors is important for aging adults to ensure that their care needs will be met. Elder care options and the circumstances to which they apply are important to consider as a part of planning. In the next section, I address these options. Aging citizens should learn about three major categories of elder care: independent living, assisted living and long-term home care, and continuum living facilities and nursing home care. The first category, independent living, describes unobtrusive types of care and support programs that primarily help with simple daily needs. For example, independent living facilities, or ILFs, are privately owned congregate housing establishments that rent out easily manageable apartments to elderly citizens. Along with offering a social and independent atmosphere, ILFs can help with maintenance, transportation, chores, and group meals, but otherwise do not interfere with their residents' lives. The cost of ILFs can range from $1,000 to $2,000 a month, excluding housekeeping. At-home family care and government support programs, which can be accessed through the AAA, are also types of independent living care. Both of these types of care can provide meals, transportation, assistance with chores, and other basic tasks at no cost to at-home seniors. Care options within the independent living category are cost-effective and best suited to people who have not yet suffered substantial deterioration to their physical or mental state, as the care offered preserves the recipient's independence but covers only simple tasks.
The Area Agency on Aging doesn't provide direct services except for the Ombudsman program, which is for folks living in long-term care. However, for services on the community level, we contact with each county for services such as home-delivered meals, senior centers, in-home aid services, that's personal care, adult daycare, day health, transportation, health-based other programs like Healthy Living, for example. So there's a number of programs that are provided in each county, and we administer the funding from the federal level for those programs to happen. Family caregivers provide a huge amount of unpaid caregiving in this country, more than $69 billion a year. And family caregivers are very important. They are caring for someone 24 hours a day, 7 days a week, with little to no respite. And it is a situation where a lot of family members may have to quit jobs to care for a parent because they can't afford the care. Family caregiving is really a huge issue in this country because of the fact that a lot of people can't afford the care. However, we have a family caregiver respite program where we can provide temporary emergency respite for unpaid caregivers. And all they need to do is contact the Area Agency on Aging or one of our local counties, and we can put caregivers in touch with that.
The second category, assisted living and long-term home care, provides more substantial types of care such as a greater involvement of nurses and other caregivers. Assisted living facilities, also referred to as personal or adult foster care, are communal residential establishments that offer more substantial care programs and social activities than independent living, but still feature an essentially independent living arrangement. Assisted living facilities offer support with daily tasks and care such as bathing, toileting, eating, and dressing to help elderly adults whose needs surpass those covered by independent care. Assisted living can cost between $2,500 and $5,800 a month. Long-term home care is an alternate option that involves hiring home care providers from private agencies to meet the needs of a senior citizen at home. Long-term home care is best used in conjunction with active family support. Home care does not provide much social involvement for elders and has a monthly rate ranging from $400 to $2,500, depending on received services. Interim Health Care is an example of a long-term home care provider.
Interim Health Care is a home care agency providing both skilled and non-skilled aid services and nursing services for private pay, private insurance, staffing, and Medicaid. When it comes to nursing, we're able to do anything from pediatric to adult, high-tech, and what we call low-tech type services. High-tech can be anything from ventilator, a baby on a ventilator that's coming home from New Hanover Regional, that needs suctioning, needs critical care in the home, 24 hours a day, to nursing services that are what we call intermittent. They may be every month, once a month, to check for things like med pre-fills for a client, or catheter care, or just their cognitive situation. Now on the other side, we have nursing assistant services. They run the same gamut. They can be high-tech services that require what we call a nursing assistant 2, an NA2. They may have suctioning that has to be done for the client, all the way down to just custodial type care for our chronic condition clients, people that may have diabetes and they need to make sure they're getting a meal prepared. each day. Or they may just be checking on clients that are private pay. We're doing sitter type services. So it can be anything, pediatric and adult, all the way from high-tech nursing in the home, all the way down to nurse and assistant in the home that is just providing companion type services.
Finally, the third senior care option is continuum living facilities and nursing home care, which offers the widest selection of care options as well as the most extensive amount of care of the three main elder care categories. Continuum living facilities offer private living arrangements and simple forms of elder care that increase as the elderly residents' needs increase. These forms of care range from simple chores to skilled nursing services as well as hospice care, and is ideal for seniors who suffer from progressive conditions. By providing a wide range of resources and support, continuum living facilities also reduce the number of times a person must transfer residences as their needs increase. Nursing homes, on the other hand, provide 24-hour professional nursing care to residents who are bedbound, need a respirator, or simply require constant medical attention. Along with providing professional nursing care, nursing homes offer social involvement activities and daily housekeeping. Nursing homes can be very expensive, costing anywhere between $4,200 and $20,000 a month. Continuum living facilities and nursing homes are both suited for seniors dependent on large amounts of support and can be quite expensive, so aging citizens should avoid this category until there is an extreme need. One program that shares many of the characteristics of continuum living facilities is the Elder House and PACE program.
Elder House of Wilmington is a PACE program. And PACE is a Medicare acronym for Program of All-Inclusive Care for the Elderly. So for someone to enroll in, be part of Elder House PACE, they have to have some criteria they meet. One is they have to be nursing home level of care, as determined by the state of North Carolina. Two, they have to live in the service area. And our particular service area is all of New Hanover County and half of Brunswick County, the northern half. And the third thing is they have got to have a payer source. So, meaning Medicare or Medicaid or private funds to pay for the services. So, when you enroll in Elder House, it's a flat rate. Our fee is about $5,500 a month. And we are responsible for all care that an individual could need. We provide primary care, dietitian, therapy, nursing, counseling services, and nurse aid services, as well as meal services here in the center. And also we provide home care in the home. So those services we provide directly. All other services such as hospital, pharmacy, specialty services, x-rays, we purchase those services from community providers. So in a sense, we're a one-stop shop for all the healthcare needs of any individual who enrolls in our services.
In conclusion, with education and planning, elder citizens can take an active role in shaping their future. Planning with family, friends, and professionals ensures that aging citizens are aware of the support they have, the assistance they need, and the steps they must take to secure these things. Choosing care options and assistance plans in advance helps ensure peace of mind and a sense of control for people as they grow old. So to everyone watching, I wish you happy planning and a happy future.